Anti-wrinkle treatment. One of the most profound ways of helping prevent wrinkles and treating existing ones is using botulinum toxin A as an injectable treatment. It's most commonly known as a brand name called Botox, but it also has different licenses in the UK under the name Vistavel. There are also other fully approved brands in the UK such as Dysport, Azalor, Bocacur and Xeomin. On a basic level, it temporarily stops the muscle from contracting. The muscle is directly attached to the skin in the face, which over time creates wrinkles. If we soften this movement, then the wrinkles become a lot less visible. It doesn't work immediately. It starts to work after a few days, and then you get a maximum result around about 3 weeks. It lasts around 3 to 4 months, depending on how subtle the patient wants the result. After this time period, the muscle starts to contract again as normal. So it's completely reversible after that time period. So let's bust some myths that you hear so frequently in the media and when you're talking to your friends. A lot of people are worried about looking overly frozen, and one of our philosophies is taking into account very closely the expressions of an individual face. I treated patients for a global campaign for the brand Botox called Real Expressions. My patients' images were displayed all over the world, throughout lecture theatres and on the sides of buildings, representing on how Botox and filler should look. The aim of the project was to soften lines and make my patients look incredible, but with full preservation of their natural facial movements. How much bad work do we see? People looking frozen or very weird. I specialise treating a lot of actors and actresses, and it's important for them that they retain full normal facial movement. I use these techniques on all my patients. So most definitely Botox can be used to actually soften some lines, prevent others from forming, but still allow a very normal facial expression. Another big myth is safety. Is Botox safe? Botox is one of the most researched drugs worldwide. Around about 7 million treatments are performed every single year around the world. It's heavily researched. There's a lot of data out there proving not only short-term safety, but also long-term safety. In fact, there's a lot of young children who have Botox for certain medical disorders, such as dystonia and muscle disorders, and they have it in very, very high doses, much higher than we use in cosmetic treatment. There are also many other great uses of Botox. It's fully FDA approved for migraine treatment. We have so many patients that have suffered for years, trying different treatments by their GP or even neurologists. They come to us as a last effort because they've heard it could be used for migraine. And they get really good results, where many can be almost symptom-free in some cases. We also use it for teeth grinding and the locking in pain that's associated with teeth grinding or bruxism. Of course, it's important to rule out dental or more serious causes in some of these medical cases. We have patients that are actually referred by dentists and other specialists to improve their symptoms. By relaxing the jaw muscles, it can help sleep, as many will suffer at night. Cosmetically, we can slim the face using Botox. This was a treatment made popular initially in Asia, and I've lectured a lot in China, Taiwan, Indonesia, Malaysia and Singapore about this very subject. Botox is also used commonly for excessive sweating. This can be an embarrassing and concerning problem to patients, as it can really affect their day-to-day lives. Areas affected may be the underarms, the forehead, the scalp and the hands. It has an impact on clothes, social situations and can make people very self-conscious. With simple treatment, once the dosage regimen is achieved, patients can have improvement in their symptoms for up to 6 months. Botox is a fascinating and safe drug, and it's certainly not something to be frightened of. Of course, you may choose not to have it, but what I think is extremely important is that you have the full scientific information so that you can make a truly informed choice.